quick shout out to Federated Insurance, who's been sponsoring our virtual meetings. Well, needless to say, it's been an unusual year. Since becoming chairman of the association, I've only had the pleasure of chairing one in-person assembly of our board of directors. And since then, our executive board and our board of directors have participated mostly in a virtual environment. That being said, our organization has continued to operate and thrive, including our staff at Cromwell and our school, our NTech school. And you know, we've had to face the challenges of our global pandemic. Our speaker forthcoming here will give us some insight on that. But we've also had a very aggressive legislative agenda. In some ways threatens the existence of our industry. So we're fighting very hard. And we're working in concert, as you all know, with NEFI, our surrounding states, PMAA, which is now EMA. And we had a tremendous presentation by those folks yesterday. And we're all fighting hard to prevent many of these disastrous policies from coming to life. But we do have a tough battle ahead of us. Of course, like I said previously, there's a light at the end of the tunnel. CEMA, as well as other trade organizations, we've rallied around our biofuels initiatives. And Chris, if you don't mind, if you can mute the other microphones for me, please. I'd appreciate it. The biofuel initiative, we've been rallying around that, which has been provided as an environmentally sound solution, available now for our existing network of reliable dealers. But it's an initiative that's going to take the entire group to participate in, our dealers, our wholesalers, and our manufacturers. As we all know, when our elections coming up, you know, those decisions will have profound changes upon our industry. And they will, in some way, dramatically affect the future of our industry and your business. But like I've said before, if the winds of fate don't blow in our direction, we have to be prepared to stand up for our industry, our businesses, our families, our employees, and above all, our customers. So I want to take an opportunity very quickly to thank our CEMA membership for supporting the organization, our executive board, our board of directors, and our committee members. In the interest of being respectful to our speaker's time here, I'm actually going to probably skip over some of these thank yous till the end of the meeting and get right into our first discussions we have here. And before we kick this off here, you know, our guest speaker today, we're honored to have Senator Saud Anwar, and his bio and background are incredibly impressive, and I'm going to read them to you. He was elected in February 2019 to represent the residents of the 3rd State Senate District, towns of East Hartford, East Windsor, Ellington, and South Windsor, chairman of the Housing Committee and vice chair of Public Health Committee and Committee on Children. He's a medical doctor who specializes in treating lung diseases, critical care medicine, occupational environmental medicine. He currently serves as chair of the Department of Internal Medicine at Manchester Memorial and Rockville General Hospitals. He was trained in pulmonary and critical care medicine and holds a master's degree in public health from Yale University. He's been recognized by the American Red Cross for his response to September 11th and received the FBI Director Robert Mueller Award for Community Leadership and Alliance Building, Anti-Defamation League's Torch Liberty Award, the National Council of Community and Justice Human Relations Award, the Manchester Community College Leadership Award, the Department of Justice Attorney's Office Community Service Award, South Asian Bar Association of Connecticut Trailblazers Award, the Eastern Connecticut Health Network Members Community Service Recognition Award, and the Connecticut Bar Association Citizen for the Law Award. I hope you have big walls. You do, as I can see, you got big, doesn't look like you have any space left on your walls there.
You know,
Uh,
and Gary, this didn't quite make the bio, but I will also say that he has been a good friend of our industry. His relationship with Imperial Oil and Mitchell Fuel is to be commended for the types of ties that he has to his community and the businesses that he represents there. And I will also point out to everyone on the phone that the senator was the one who wrote us our guidance on safe HVAC entry into homes back in March. So before the CDC or OSHA had any guidelines for us to follow, Senator Anwar stepped up, provided us written guidance through Mike Sanzo, who's the chairman of our Next Generation Leadership Council, and we were able to distribute that to members, providing a lot of confidence in everyone in being able to perform our essential duties to work on people's heating and air conditioning systems. So, Senator, thank you very much for that. I wanted to mention that.
Thank you so much for your very kind introduction, and I want to make sure I'm not muted because I can speak for half hour and be muted. So thank you, Gary, for your kind words. Thank you, Chris, for your kind words. And look, this Connecticut Energy Marketers Association, you are my friend because you are friends of my friends, Mike Sanzo, who I have deep respect for. Imperial Oil and Mitchell Oil, both of them are family to me because they are being part of the community and they help the community in so many ways. I just want to also mention what I know about your organization is through Mike Sanzo. You have like almost 6,000 or so members, 600 or so members with 13,000 or so workforce that you have. And each of your businesses, the small businesses in the community, are community building businesses. So if you look at small activities, large activities, activities with students, athletes, all community building things, you're doing that at the grassroots level. So you're not only providing them the warmth through the heating systems and energy that you're providing, you're giving them the positive energy and warmth of your kindness. So I want to thank you for the work that you're doing. And what I will do is I'll talk a little bit about the pandemic and then where we are and which direction things are going in, and share my perspective on the next phase of this pandemic. And then I'll talk about something that is important to you about the legislations which are somewhat threatening to you. And I have a unique perspective which I will touch on. And I know I'm supposed to be here for 30 minutes, but if your questions are going to last and you allow me to, or if you need me to, I will stick around for much longer, as long as your the questions and issues are addressed. This pandemic has changed our lives. Everybody's lives has been impacted, and we were never ready for this. We could have never been ready for this. And this is part of our challenge at this time, where many of you may be aware of friends or family or individuals who may have lost their lives or their well-being, and you are, I'm sure, aware of individuals who have lost their livelihood in this process, including your own businesses have been impacted. I'm a small business owner. We have had major challenges ourselves financially because end of the day, you have to survive through customers that you take care of, provide services to. So I'm part of the service industry. You're part of the service industry. I recognize that. And so that's been a challenge, and that will remain a challenge because we are seeing a gradual increase in the number of cases across our state. You know, there's, for example, in the Norwalk Hospital, I was talking to some of the ICU nurses there. They've had new cases on ventilators. They've had more cases coming in almost every day now. And just like in the past that we had seen the densely populated parts of our state, they're seeing the resurgence of the disease. And we are in better shape than we were with respect to our abilities to manage it in the ICU. If somebody is very sick and unwell, we actually have the capacity to be able to address that aspect. To a little bit better degree than before. The other thing is that our testing capacity is much improved as well. So that actually gives us some strength too. The vaccine is the part that I think is worthy to have a conversation about, because that is going to be, which is going to give us a long-term relief and then hopefully some movement towards normalcy in our lives going forward. So there are some 40 plus companies across the world who are trying to come up with the vaccines. The ones that are in the ones that are in China are ahead of the curve with respect to them going through phase 3, which means they have done a much larger study and they have had approval of some of those in their own regions to be able to use them. There are multiple US companies that are doing them, the studies as well, Pfizer being looked at much more closely at this time, while there are about at least 15 more US companies that are looking at various ways to help create economy for us. So right now, I think the challenge is going to be what do the results show? So I can tell you that the good news is that in my conversations with some of the scientists and people working within Pfizer, and because it's in Connecticut, I do have some access to some of the people that I know, they are being very robust on their research study. So, and the antibodies are being produced through those initial vaccines. They obviously have not been approved at this point, so, but they are already producing millions of the vials as we speak. And the reason they're probably producing them is that they feel comfortable that they're going to be reliable in their ability to get approval from the FDA. If I look at the CDC's recommendations and also the state's recommendation on how to manage the vaccine, they have shared some scenarios. One of the first scenario is a description of a vaccine, which is very close to what the Pfizer's vaccine would be. So maybe what I'm sensing is by December, there's a chance that we may be able to have a US-based vaccine get approved. And then there's going to be opportunity to consider that usage. We will start with the first responders being the ones to be on the list. And I've looked at the initial guidance that has been in place from the governor's task force. And it looks like the general public will be in phase 2 and phase 3 in some respects of getting some of the vaccines. The vaccine itself, let's say, for example, if it's the first vaccine from Pfizer, it will need to be, people will get one injection, and then about 21 days later, they will get the second one as well. And there will be tests to be able to prove that people are developing the antibodies. Antibodies are a way to be able to show a reaction that person has developed antibody. Even if the antibodies go away from our body, there's immunity that still stays. There is a small chance that this virus may mutate in future, but even if it does, we would have created the machinery to have the vaccine movement. If it's every 2-3 years, we have to change and get another vaccine, we may have to deal with that accordingly. But at least we are on the path of a preventive strategy going forward beyond the preventive strategy of the mask and social distancing that is being effective. Between now and then, having the social distancing is a smart idea so that we are not a part of the vectors or the people who develop the disease. So in the next few weeks to months, we will hear a lot more about the vaccines and the relevance of that and the preventive strategy around that. I think that's good news. I can tell you that we will have some capacity to be able to get our lives back. The cost may be in the $30 to $60 vaccine range is what I have read so far. This could be changed. If the insurance industry gets their hands on it, it's going to be thousands more. But that's the usual phenomena that we see with the insurance industry. But I think there's a pretty good chance because of the public health reasoning, the federal government will support and be able to help out, and the insurance industry will be able to not go out of control on the vaccination and the access to this. So if that happens, then overall, I think we will get our businesses and industry back in order. So that's something that I'm giving you hope there, and I'm myself hopeful. I have the litmus test in my mind is that whatever vaccine, whatever medicine that I try, I look at it if my family and my whatever the age group or myself, if it is good enough for my family, only then I would recommend it to anybody else. So if the vaccine is there and I look at the data, I will take the vaccine before I would recommend it to anybody else. So That's just the principle I work with as a physician, and that's what I would expect my fellow physicians to do as well. So I would not experiment on you, I'd experiment on myself before I would say that, hey, go for it. Now, the next step, what are the legislative things that we have to look at? Look, there's a need to protect our economy. There's a need to look at what, there was hundreds of bills that were there. Some of them were good, some of them were terrible. And those bills have been there and some of them will come back. So there are legislators. All you need is one legislator to put anything out there into legislation, and that becomes a legislation, but not necessarily does not become a bill, because you need to have enough people to vote in support of it. And so the probability of having a bill, having a legislation become a law takes a lot more effort. And that's why we have to make sure that we look at the details of some of those. So there will be a lot of those bills that will come back. But having said that, there will be some new ones which will be relevant to the current challenges that we have faced at this time, from the economic challenges that we have faced, the challenges that we have faced with people who are unable to pay their mortgages, the businesses that have not been able to pay their mortgages. There will be some tax ramifications that will have to be addressed. How are we going to make sure that the state finances remain viable? So those will be difficult and important issues that we will have to address going forward. And we will have to create win-win strategies around those, but we will have to cut some expenditure. And what is that going to be? That's where we'll be rolling up our sleeves and having some of those fights going forward. So it's going to be a very busy session coming up, and there'll be important things. I think it's worthy for me to touch on something that may be close to some of your members and individuals and the leadership of CEMA, which is the SB 354. That was the SB 354, which is the Green New Deal. Now, I look at myself as a progressive legislator, but I'm also a very pragmatic legislator at the same time. The idea is that I would want to have a lot of things happen, but in order for those things to happen, I have to make sure that I cause no harm. And some of the things sound very good on paper and in conversations, but what does it mean when you implement it? So those are the parts that are very relevant. So yes, we want our climate change to be protected. I don't know a lot of people, except maybe some, who would say that climate change is not a real thing and we don't want to worry about it and everything is going to fall into place. And everybody wants to be responsible, and you are responsible employers, you are responsible business people, you're responsible community citizens, and you are also interested to make sure that the climate is protected. Having said that, what does that entail? Because sometimes our actions are meant for the right thing, but our actions end up doing totally opposite of what is the intention. And sometimes these bills may actually cause more harm than benefit. So I think that's where the conversations need to be, and that's where the strategy needs to be. And that's where I think the way the bill is to be able to say that thousands of people in our state are going to lose jobs in the midst of a pandemic, and post-pandemic, we're trying to bring recovery. We are going to be in the position where we have seen recently what a monopoly of one company can do to the lives of citizens in our state. And that's where you say, you know what, you need a marketplace. And this is like a textbook case of a marketplace value, that in the market, local community members, I want to be able to go and knock at the door of Mike Senzo and say with Imperial Oil, hey, you know what, I got the oil the other day and I can get it for 2 cents less from somebody else. Can you help me? And that's the conversation. And then I would say that, look, Mike, I lost my job this winter, can you help me out? And you'd be surprised how much help you and your members provide every single year to so many people without making it known to people, because there's food bank and there's a fuel bank, and you're doing that. I don't see these large centralized corporate energy companies like electricity companies doing any of that work. They're actually taking away more than they are giving. And that's the reality of this. So We don't want a monopoly. We don't want companies that actually are charging, if you have $20 bill of the use of electricity and you're paying $200 for the distribution of it. This is not sustainable. So you're in a far better position to touch the hearts of legislators, even who may have not been willing to listen to you after what we have seen, what Eversource has been doing and continues to do, if you will, because I've not seen them change their behaviors in some respects. So those are the areas that we will have to have a broader vision. Yes, we need to have a climate strategy in place, but we don't need to do that in a manner that is going to hurt our local businesses and sustainability of those businesses. And I'm going to be very much available to listen to this more and make sure that me and my colleagues don't end up doing harm in the process. I will stop here, and I'm sure people will have some questions. If they would like to ask me, I would be honored to answer. Thank you.
Great, and thank you very much for your insight on both those topics. I would like to maybe kick it off by stepping back to some of the stuff you were talking about in regards to the pandemic and the vaccinations. I keep hearing and reading about a lot of questions in the public regarding taking a vaccination. And number one, I will wait for you to take yours first before I take mine, just because you've promised that if you're exposing yourself and your family, that is something that's safe, which I have no doubt will be the case. But for the people who are skeptical, and regardless of whether physicians and scientists say that this is a safe approach, how effective can the vaccine be if we only have limited participation?
Yes. So some of the skepticism is justified, and I'll tell you why. There's no such thing as 100% efficacy of any vaccine. So that's one reason. While you can get 99%, 90%, or 95%, you're not going to get 100%. So people say, if it's not 100%, I don't want it. But I would make an argument that risk of getting the disease being 100% versus preventing it by 95% is still the better choice. The other part is that there is somewhat of a monopoly for these multi-billion-dollar giant pharmaceutical companies. And I agree with the people who are skeptics, because uncontrolled, unchecked power is very dangerous. And that's part of the reason that my hope and efforts have always been to make sure that the FDA is not political, the CDC is not political. And during this pandemic, we have unfortunately seen a little bit of political component to both of them, because we as a society have not faced anything like this for 100 years. So we have acted not in the planned manner at this point. And that's part of our challenge to overcome. So yes, there is reason for skepticism, and anybody who's going to come up with this is going to make multi-billion dollars in this entire industry. So that's the reality. So there, people will try to cut corners, and that's why I want to look at the data and then look at it and try to see what's the data in other parts of the world on the same types of vaccines that are being created. So that's the part. So that's the skepticism. The efficacy, I think as soon as we have the data, I can tell you the initial results that we are seeing in some of them are a milder form of the disease. Now, there are 46 different vaccines that are being tried. Of those, 3 have been stopped from moving forward, because those vaccines resulted in at least 1 or 2 cases out of thousands, which were unusual neurologic disease in them. And as a result, those studies were stopped, and the companies did the right thing at that time. And these were out of the United States companies, but US is part of it. The trend you're seeing is that there's a collaboration between the Chinese company and the US company that are collaborating together, because the population who has been impacted in China and the fact that they were 3 months ahead of us in the disease, that has allowed them to be ahead of the curve in finding the solutions, but they are getting empowered by the money from the US, but also the scientists from the US who are making sure that things are robust. So we will have enough data to feel comfortable going forward. I think it will be studied going forward as well. The problem that we will really have is that for some of the vaccines, we have about 5-10 years of research on all of the others. the probabilities of can somebody be hurt out of 1 million vaccines? Yes, that risk will be there. And then those are the data that we'll find out. And we'll also find out if 4 or 5 years down the road, were there long-term effects? And I don't know the answer to that. Nobody else will. The only thing is that we know that there are short-term and long-term effects of the disease. And so in that situation, you say, well, the disease is worse than the prevention, so I'll take the prevention. And that's what we will see at this point. And hopefully we will be right 5 years down the road. And that's how we'll have to approach.
So I hope you don't take this as a setup, but and I would have prepared you for this question, so it's okay if you need more time to think about it than reacting right off the bat. But I got a call this morning in advance of your discussion with us, and someone asked, as a business owner, if a vaccine becomes available, can I require my employees to take it? Now, I don't think that that's going to be a widespread feeling by most employers, but I did receive the call today. Do you know if an employer can require employees to become vaccinated before they return to work?
That's a very good question. So this is the part where I'll tell you my gut feeling. Okay, the answer is no. That's my gut feeling. And the reason is every action has a probability, and when your information on the probabilities is very good but not perfect, especially it's like a 4-month study, 6-month study, it's not good enough for us to try to mandate things on people. And that's the part that gets a little bit tricky. We have to be a little bit cautious on that end. We are accumulating a lot of data.
Yeah, it's just ironic that, we recently had that debate at the legislature about vaccines before the pandemic was even conceived of, and now we're in a situation where it probably have changed the minds of some. But thank you for those answers. I appreciate it. And I know that last question was a little unfair.
No. Hey, I look at you all as my friends. So ask me anything. You'll not hurt any of my feelings. So feel free to ask me anything.
I have a question, a few questions.
Yes.
One, in terms of the rollout of a vaccine, because this disease has a dramatically higher impact on the age population over, say, 70, I would imagine that those folks in those risk groups would be probably in the same area expediency as first responders. That would be my guess. I'm not sure if that's the case. That's one question I have. I guess I'll just line up my questions here. Second question is, I have been told that large pharmaceutical companies are immune from legal attacks should their vaccines go south. And I'm not quite sure if that's true or not, or what the extent of that protection is. And I guess my third question, sorry for stacking these up, is that this vaccine, these vaccines were accelerated, and from what I'm told, in a dramatically reduced amount of time. I'm told that they normally could take 5-6 years for this research. And my question is how did they, compress this into such a short period of time? Sorry for stacking the questions here.
No, these are very good questions, and I'm glad you're asking them. So I'll start with the last one first. While most of the vaccines take a much longer time, and in ideal circumstances, this should take a little bit longer as well. We have such a huge supply of patients. Because we have 7-8 billion patients right now, or potential patients right now in the entire world. So because it's a pandemic, and if you look at the number of people who are having these studies, I'll tell you, I was reading up one of the initial studies that the Chinese company is doing. They're getting their vaccine to their military personnel. So they have like thousands of patients that were getting a vaccine as we speak to get those tested. And we did not have that luxury of having such a large patient population to be part of the study. So this is being leapfrogged so fast at this time because of the sheer number of possible patients and the preventive strategies that can be created for them. For some of the other vaccines, because those diseases were not as widespread, it was taking much longer. Having said that, The side effect profile, which is long-term, that will remain a weakness. So there's no shortcut to that part because time is of the essence to be able to get to the long-term implications of those. Whether these companies can be sued or not, so the federal government created a way to actually have each one of these companies put certain amount of funding, so which actually is used as a fund which has continued to grow, so that that allows an individual, if they have a side effect or a negative effect from a vaccine, to get paid for that. And the way it has been done is in my mind a very fair manner. The vaccine, the people who are against the vaccines, they use that as an example to say that vaccines are bad. But I'll if you would allow me, I'll take about 2 minutes to explain to you why and how this was created. So when you have a vaccine and that's going to be given to thousands of people, it's a probability issue. So if everybody drives in a car and 1,000 people drive a car, one of them is going to have an accident. But that because that one person is going to sue one company or one place to be able, which is a source of that situation, you have to have a mechanism to have protection for that company. So the federal government said, look, we have calculated that you are having to make the vaccines, and we are requiring that the vaccine be available from a public health point of view. So we will expect you to put X amount of dollars, a certain percentage of the funds that you're going to make from that vaccine, into a fund that is going to be independently managed. And the threshold for complaints acceptance that this was a side effect is very, very low. In other words, literally people would go out and say that my loved one has had a problem from the vaccine. The burden, in a usual lawsuit with the pharmaceutical company, the burden of proof is usually on the part of the person who's complaining, and they have to be the ones to prove. But with the fund that has been created through the money which has been growing, the burden of proof is no longer on the person who complains, and as a result of which, anybody more or less who complains gets the funding from there. They have to prove that they have the disease, and they would actually have to prove that there's some plausibility, and they will get them funding. What that has done is that has actually created a way where more people complain, because that's how they make more money to be able to take care of their loved ones who have been arguably impacted by the vaccine. But it sort of skews the numbers in the direction of vaccines causing more problems. And so it's sort of if you know the whole history, that makes more sense rather than just saying that 4,000 people have complained about X vaccine. Well, if you really tease down to those numbers and do the broader studies, those 4,000 are not real numbers. They are just the ones who complained, and they got the money because how the federal government set up that program. I think that program is very good still. The reason is that if somebody is worried about their loved one getting infected or impacted, and they should still be able to not spend their lifetime fighting these big companies forever, because let's say who's going to fight Merck or Pfizer as individuals, right? A parent or anybody, it's going to be a nightmare for them to be able to fight that. So those are the two part. The first part, can you just repeat your first question?
I was just asking about, just because of the dramatic age disparity and susceptibility to the disease.
You're absolutely. They will be part of it. Yes, they will have to be part of it. The nursing home residents will be part of it, and the people with diabetes, hypertension, people over the age of 65 or so would be part of the first. Arguably should be part of the first phase, but with that caveat that I'm not part of that decision making, but this is what would be recommended based on the risk profile.
Sure. So I want to marry your two expertise, since you are a top-notch caliber state senator and a physician. That last topic that you talked about a little bit is really important to us, and I'm speaking to the potential liability of an employer whose employee becomes sick and claims that it happened on the job and may even die. We know that hospitals have been provided protections and that there is some discussion at the federal level to provide protections for businesses. I know it's really controversial. Is there discussions in Connecticut about providing essential employers protections against claims? One of the things that I talked to our members about recently is that I've noticed that Carter Mario and Trantolo are starting to pop up saying, "Are you sick? You should sue your employer." We obviously, as small business owners, are very, very concerned about this development.
Yeah, Chris, that's a phenomenal question. And actually, frankly, the healthcare part was on my radar, but the rest of it has not been on my radar. And for the healthcare, I can tell you that I've been in touch with the nursing staff and nurses aides across the state who actually are directly taking care of the patients, and some of the hospitals have said, "Hey, we don't know if you got it from home, so we are not going to take care of this." And I've been supportive of the staff for sure to be able to take care of that part. But I think that we will have to come up with a better understanding of the other industries. For example, if your HVAC technician is going to somebody's home, and the people in the home will ask that question, "Have you been infected, or do you have any fever?" And then vice versa should be the question. But most of the time, they're not the ones who are asking those questions. They're going with the assumption that the people in the place have a disease and then they're likely to be infected. So he or she is protecting herself when they go there. But if they get infected, is there a way for them to be able to prove it was on the job or not? And then that's going to be something that we will have to figure out. And I don't have an answer, but I'm putting this on my list of things to do.
Glad we could spot it for you. It's
Yeah.
clearly it's clearly on the minds of all business owners, and especially small business owners. And we've heard about other industries that have received those protections for obvious reasons, especially those on the front lines of treating people who are ill. But there's a whole bunch of essential employers out there that their employees could get it anywhere, but if they're going to look to the deep pockets, and now that Trantolo and Carter Mario's on it, I'm sure we'll be in the crosshairs.
Yeah.
I have a question too.
Yes.
You go back to where you said about this might be a good opportunity for us as an industry to take advantage of your colleagues in Hartford, and the fact that we're not a monopoly and we do care about our customers. And if you really truly believe that, if you think we really have a chance of having a skin in the game and being part of the solution and not just the scapegoat problem that we typically are.
I think so, and the reason is again, in my conversation with I know the two companies in my town, and they're part of they are neighbors, they are community members, they are part of the solution for issues in the community. Mm-hmm. So if somebody from either one of the companies would have a problem, the entire community will stand up and say, "Hey, these are our families, these are part of a community, how can you harm that business?" And I presume with my conversation with some of the other businesses who are your members, it is a very similar relationship. So your community buy-in is very critical, and that is already there because you have been part of the neighboring communities and so on. And I don't like monopolies because absolute power corrupts absolutely. So that's why it is important to use that conversation around the fact that you are right there, you're part of the community. Now, you will also have to figure out, and I think there are oil-based products which are environmentally more friendly, and you're already way ahead of the curve. So I've been in conversation with Mike, who actually educates me on some of the carbon footprint reduction that the industry has been taking on directly as well. And that message never goes through. That message is like when you are willing to sit down and have a conversation, only then you listen to it, but it never comes to you through other means. So the other messages are coming to me nonstop, that the carbon footprint is higher in your industry and so on, but your part of the narrative isn't there. And I think that's where there is an opportunity to work on that part, and then also use this new part, because what Eversource is doing is unfair and wrong, and it's they're also publicly traded, so they're working more for their stockholders than for the community. And you work for the community and you're part of the community. There's a big difference.
The good news is that we can report to you that we've just learned that the Governor's Council on Climate Change is including our biodiesel blended products in their future recommendations. So we are making some progress, but you're right. I think you sense from Kate's question the frustration about local businesses having solutions, but the Department of Energy and Environmental Protection continues to side with utilities. I agree with you that perspective may be changing now because of the recent developments. It's just a matter of us monopolizing on, or bad word to use, but leveraging that to get our story across.
Yeah, absolutely.
Thank you.
Gary, I know we're running a little long now. I didn't know if anyone else had any other questions or.
Yeah, if there's no further questions by anybody, I want to be respectful to the senator's time. We're honored to have you address our group, and we thank you for your medical expertise and your service to our state. Means a lot to us. And if there's no further questions, we'll move on.
Thank you.
Thank you so much, and thank you for having me. And I'm available to you whatever the next session suggests. Thank you.
Fantastic. Take care.
Take care.